Welcome to the Dairy News and Views podcast, a production of the Iowa State University Extension and Outreach Dairy Team. Our podcast covers current educational, research, and industry tools available for your operation to manage healthy cows and calves while producing the highest quality dairy products.
Welcome back to ISU Dairy News and Views, the podcast where we bring you timely topics to help your dairy thrive. So whether you're on the farm, in the barn, or on the road, we're glad you're tuning in. I'm Jen Bentley, Dairy Field Specialist with Iowa State University Extension and Outreach. And today we're diving into one of the most critical steps in raising healthy dairy calves, colostrum delivery strategies. And joining us are our experts who have been studying how timing, volume, and quality of colostrum impact calf health and long-term performance. So today we're going to explore best practices, recent research, and some practical tips that you can use to implement on your farm. So I want to welcome our guests here today. We have Dr. Donald Sockett, diagnostic case and outreach coordinator at the Wisconsin Veterinary Diagnostic Laboratory at the University of Wisconsin-Madison. And he is responsible for diagnostic cases that are submitted to the lab by practicing veterinarians and livestock producers. And he also conducts outreach education with the vet lab. And then we also have on our call here today, Dr. Ryan Breyer. He holds a dual appointment as a diagnostic case and outreach coordinator at the Wisconsin Vet Diagnostic Lab, as well as a clinical assistant professor of large animal internal medicine at the University of Wisconsin-Madison School of Veterinary Medicine. He has a focus in consulting with veterinarians as well as teaching vet students, and he has an interest in large animal internal medicine, concepts of AVMA approved humane euthanasia for large animal species, herd health, and calf welfare investigations. So a lot of good expertise here with Dr. Sockett and Dr. Breyer. So welcome to our podcast.
It's great to be here. Thanks, Jen.
Yeah, always enjoy visiting with you two on colostrum management, delivery strategies, and recently you were both on our heifer webinar series on colostrum delivery strategies, and we had a lot of good conversation and good questions that came about with, delivering the highest quality colostrum that we can with our calves. So I first kind of want to start the conversation with just, why? What makes first milking colostrum so powerful for our calf health?
Yeah, that's a great question. I'll start off and we'll kind of team it through this podcast, Dr. Sockett and myself. But first, milk colostrum is really important because these calves, as a bovine species, are born gamma globulin anemic. Try saying that 5 times fast. But basically, they have a very naive immune system and need that colostrum, as it is rich in a lot of maternal support, not only IgG or immunoglobulin G, but other factors that are also supportive in health. But that the major component that we like to focus on in veterinary science and health and well-being of calves is IgG, which is that immunoglobulin G antibody that is passed from the cow, to the calf via colostrum. And that's why it's really important to help set these calves up with good health, because they are born without an immune system, or it's a naive immune system. Dr. Sockett, any thing you'd like to add about the importance of colostrum?
What we mean by the naive, the immune system is fully functional at birth, but because it hasn't been exposed to any foreign bacteria, viruses, whatever, it's naive because it hasn't encountered anything outside the uterine environment. So it's naive to everything around it. But so the colostrum helps it transition to have a fully functional immune system. But all the tools are there, but they haven't been trained up yet when they're born.
Yeah, so I kind of like to, as I visit with producers, it's kind of a non-negotiable for calves, right? It's the very first thing that we should be thinking about when we're taking care of our calves. And I've heard the term, like I think Sandra Godin has used, liquid gold, right? So it's very important that they get it. And as we talk about quality of IgG, I know we've had some recent findings on what we consider excellent quality target. And so can you explain that a little bit more about where we should be with these targets?
That's a very good question. And just to step back for a minute, the it was recommended that the colostrum should be 50 grams per liter or higher in concentration, or have a colostrum brick score of 22% or higher. The problem with that is you're treating all the colostrum the same. And there's been numerous studies have shown that the average concentration of immunoglobulin or IgG in these calves is not 50 grams per liter. It's more like it's typically around that 75 to 95 grams per liter. And so if your average, there's a herd in New York, they published their average concentration was 93, 95 grams per liter. If you're treating it all like 50, you're wasting a lot of colostrum. And you're not taking advantage of you're taking advantage of the fact that it's higher quality, which means you can feed smaller volumes, get more efficient absorption. All that comes into play. So what we consider, based on our work, Ryan, my work, we consider the fair quality colostrum is colostrum 50 grams per liter to 74.9 grams per liter. Good quality is 75 grams per liter to 99.9 grams per liter. And excellent quality is 100 grams per liter or higher. And it's not unusual in some of these herds that up to a third of the cows will have a concentration 100 grams per liter or higher. The highest we've seen is 300, around 300, and that's in dairy cattle.
So as we take a look at, I guess, correlating that to the Brix reading, if we're using 22% as our cutoff, if we were looking at, that good range of 75 to 99 or the greater than 100 grams, where would that reading be on the Brix?
Yeah, that's a great question too, Jen. Our study that Dr. Sockett had mentioned before, it was published back in 2023. And what we found, both a calculated Brix percentage and we proposed a Brix percentage that correlated with that colostrum IgG grams per liter. And what we had found in that study is that 50 grams equal to or greater than 50 grams of IgG per liter correlated to a proposed Brix percentage of 22%. That's 75 grams per liter or greater correlated to a 25% Brix reading, and then greater than or equal to 100 grams per liter, we found to correlate to a Brix percentage of 30%.
I'd like to follow that up is that those cutoffs of 22, 25, and 30%, this is how the producers need to think about it. A Brix score of 22% is only telling you that with reasonable confidence, high confidence, there's at least 50 grams per liter there. There's almost all the time there's more than 50, but there'll rarely be ever less than 50. So you should think of those scores of 22, 25, and 30 as a guarantee of the minimum amount of IgG that's there.
Mm-hmm.
And what we also found too, Jen, as those Brix percentages increased, we had greater spread around that correlation line. So like Dr. Sockett was saying, we can at least say that at 30% Brix, we're going to hit 100 grams per liter, but that could fluctuate from 104 to 200. So it's under, and then when you would come down to maybe a 22% Brix reading, you might have a 50 gram per liter to a 60 gram per liter. So it's a little bit tighter as the percentages decrease, but as they increase, you have a wider spread of grams per liter of IgG.
Okay. And so the Brix will give us a good indication of the quality, right? But if we really wanted to get more, I guess that's a cow side or farm side test we can do. But if you really want to know, you'd have to take that to the lab to get specific IgGs, right?
Correct. And that's run by single radial immunodiffusion. And that's done in the laboratory because it needs time.
The IgGs are always nice to know, but the problem is when the calf needs that colostrum, you need something you can make a decision in real time. Mm-hmm. I need to know now. I can't wait for a day, right?
Yep.
That's the problem. Yeah.
Yeah. Yeah. So we talked about quality. Timing is just as crucial, right? So the gut's ability to absorb IgG drops fast. Can you talk a little bit more about that, about timing?
Yeah, I can start there. So the gut has great absorptive abilities, but it also has limitations as well. So maximum absorption efficiency is immediately after birth. So that's why it's recommended that calves get colostrum, or at least offered colostrum, within that 2 to 4 hour window. Close to two, the better, because as the animal ages, and we're talking hours here, it can decline quite quickly. So declining to potentially 22% efficacy at absorbing those IgGs at around 3 hours. And then after 20 to 24 hours, that absorptive ability is potentially less than, or could be less than 1%. So it diminishes quite rapidly, but that doesn't mean that the colostrum is still helpful, because there are studies out there that show that there can be intraluminal, meaning within the gut not being absorbed, that colostrum can still act against other invasive or pathogenic microbes or bacteria. Then it's still helpful too. And there's a lot of nutrition within those colostrum feedings as well. There's a process called pinocytosis, which is basically budding off of the gastric lining that absorbs those IgG, so then it can be uptaken by the animal into the bloodstream and then utilized appropriately, the IgG. But this is happening in the gut or the intestinal lining. Typically we don't see this happen very often or at very low levels in the foregut. It's happening in the absorptive abilities of the GI tract, which is the lower GI tract, the small intestine.
I'd just like to add something here. You've all seen those graphs where you show it going down. That's a concept graph. It's like 12 hours it really dips down, but it's not that sudden. It's not like I can go to my wall and turn a light switch on and off. It's a gradual thing. So there is a lot of value in feeding cat, still value, and they will absorb some immunoglobulin if you're out 14, 15, 16 hours. The only real consensus is the most efficient absorption is within the first 2 hours, and once you're out 24 hours or more, its ability to absorb globin is largely gone. That's the point. But timing is important. Don't get me wrong. But there's two more things that are more important than timing. That's the quality of the colostrum, because the higher the quality, the more efficiently it's absorbed. So if you have 100 grams in 2 liters of colostrum, or 100 grams in 4 liters of colostrum, okay? Or if you want to say 100 grams in 1 liter and 100 grams in 2 liters, the 1 liter, the more concentrated colostrum will be absorbed much more efficiently than the larger volume at lower concentration. So give you an idea, 1 liter, that super concentrated stuff, if as long as you don't feed too large a volume, you can get efficiencies up to close to, in the mid to high 40s, approaching 50%. So 50% absorption means half the hemoglobin you feed is absorbed. Okay, in the larger volume, but the same mass hemoglobin, it's not 40, it's not in the high 40s, it's down in the mid to high 30s. So you have to think about, I want high quality stuff in the correct mass hemoglobin in the smallest volume possible, and hopefully get that second feeding in no later than 10 to 14 hours after birth. That's what you'd like to think about.
And there's a lot of great studies out there, Jen. There's a good study, I believe it was in 2021, that they looked at maximizing the efficiency of IgG absorption. And like Dr. Sackett said, timing of colostrum feeding was important, less than or equal to 3 hours. But its odds ratio was 1.6, where actually the immunoglobulin concentration and the correct mass of immunoglobulin fed had better odds ratios at 2.9 and 2.6 respectively. So it's about
so what that study showed, that the concentration of the colostrum was twice as important as the timing.
Correct.
So timing is very important, but the two most important variables is the correct mass and the quality.
Yeah, so let's unpack that just a little bit more, because I know you have maybe done some studies on volumes fed to calves, or had some cases of, volume of milk fed to calves. And just to help producers understand what happens when we might feed a little too much colostrum at that first feeding. If you want to unpack that a little bit more.
I'll let Don start off.
How I explain this is think of yourself. Let's say you're a calf. Just think of yourself as a calf, and I offer you a bottle and a nipple with 4 quarts of colostrum in that bottle and nipple, and I'm suckling away, okay? And I quit nursing, and when I get up to about 2 3/4 quarts or 3 quarts, I quit. You have to ask yourself, why is the calf quitting the nurse or yourself? Why? Why? And the answer is quite simply the calf is full because there are sensors in the wall of the abomasum that they call stretch receptors, mechanical stretch receptors that communicate with the brain. And once they get stimulated enough, that says, "Hey, I'm full." That's the abomasum or the stomach in people. You quit. Now, studies have shown in people if you in the and where they continue to fill past where you quit nursing or quit drinking, that's called satiety. So what happens if you continue to fill the stomach or the abomasum once you're full? You elicit pain. And the more you overfill, the more pain you cause. And the more you overfill, the more pain you cause. It's bad enough that it causes pain, but at the same time, it's causing inflammation or swelling and damage to the tissue in the wall of the abomasum. So it's not a trivial thing to feed these large volumes can over distend the abomasum and cause pain in the calf and inflammation in the wall of the abdomen, which can lead to some short-term and maybe long-term problems for the calf. And we've published on that.
Yeah, and I think you have some work on maybe some of the short-term effects, right, of examples of calves that have gone through that. But probably in the longer term, we don't know the impacts at this point.
I can tell you this. Since we've gone to larger volume colostrum feeding, this is an observation, not based on data. It's an observation, a consensus that's been reached amongst the veterinary pathologists at our laboratory, is we're seeing more abomasal problems than when we went to these larger volumes. And the abomasal problems we're seeing, and Ryan's seen it clinically too, okay, is the abomasum, when you overstretch it, it just stops working. It stops emptying. So it nurses its meal and it just sits there and doesn't move. So what you see is a descended calf in the abdomen, and it's not interested in suckling. Why is it not interested in suckling? Because it's full. And because you overstretch the abomasum, right? You see this usually with your milk meals after the large volume colostrum feeding, is they're not going to nurse until that milk leaves the abomasum. And so we're seeing much more abomasal emptying problems in our calves than we ever saw when we were feeding smaller volumes. And the reason we think a part of it is we're over distending the abomasums and we're causing damage to the wall of the abomasum, which leads to motility and emptying problems. Emptying means get your meal out of the abomasum. So that's why we feel so strongly about you should not overfeed the colostrum. And the pathologists, they see histologically what's going on. They'll see ulceration, they'll see inflammation, and some of it's quite profound what they're observing.
Yeah, I was going to.
Not every calf will get it, but enough gets it that you realize you shouldn't be doing this.
Yeah, every calf is different, but when we see this, it is pretty substantial. We can see that disarray where if the mucosal lining is showing evidence of inflammation, lack of blood supply because of stretching, and when you have lack of blood supply, that tissue becomes ischemic or basically doesn't have the ability to bring oxygen to that tissue so it can function appropriately. And like Dr. Sackett said, it's hard for us to say if we see these calves 5, 6, 7 weeks, or even past weaning, or just past weaning, if these effects with abomasal emptying or ulcerations or even perforations of the abomasum are occurring because of detriment, because of our colostrum feedings. It's hard to say because there's a lot of different other variables that can impact the abomasum, such as medications like our anti-inflammatories or stress, the different types of feed that can be fed to these animals, or even when I say stress, that could be processing calves, vaccination, or even traveling for calves, getting on a trailer and moving someplace.
Mhm.
I always say it's easy for us to get in a car and go to where we need to on a daily basis, but calves are sensitive and cows are sensitive to that as well. Taking a ride is not as trivial as we think in a trailer to these animals. It can be quite stressful.
And then one thing I think we should add is the type of inflammation that the pathologists are observing microscopically is not caused by an infection by a bacteria. It's not infectious in origin. They're seeing that what the lesions they see with the inflammatory infiltration they're seeing those that which is consistent with pressure necrosis or ischemic necrosis of the cell wall. Okay, so this inflammatory response is not caused by feeding by bacteria, too much bacteria growing the abomasum. It's causing it's compression of the abomasal wall by overfilling that causes the inflammatory response. And the more severe the inflammatory response is, the higher probability you will have trouble, and the longer it will take that abomasum to heal.
And they've ruled that out to the infectious causes by further testing, such as our PCRs and cultures here at the lab. So we're looking for salmonella or other GI viruses, bacteria, or parasites, and rule that out when looking at this inflammation.
Okay.
So it's not because of that.
Yeah, that's good to know because I spent a lot of time of my extension work talking about cleanliness of colostrum, right? The feeding and how we store it and handle it and pasteurize it. Although those are very important factors, right? So they're kind of two
Yes.
separate things of, yes, cleanliness is important, but also volume needs to be taken into consideration. Um, so if I was working with a producer or somebody's listening and they don't currently test their milk, their colostrum quality, how would you say they go about um, getting set up to make sure that they just don't feed 4 quarts because that's what they've been told to do, right? Like, so what should they start with?
That's a really good question, and the answer is every herd is different.
Hmm.
And so the colostrum program that works in producers A herd may not work in producer B. So what I tell people to do is before I design a program, I said, I need some basic information. Obviously, some demographic size of the herd and all that kind of stuff. But when it comes to colostrum feeding, what is your range of weights of your calves? What are your smallest calves weigh? What are your average weight? And what are your larger calves weigh? Because almost all the operations want to feed all the calves of the same fixed volume. Okay, they don't want to. Very few change the volume they feed based on the size of the calf. So you need to know what's the size of my calves, and what's the average size, and what's the smallest size, and what's the larger size. That's the first thing. The next thing you need to know is what's your range of brick scores you're seeing in this colostrum? What is the typical quality of your colostrum that you're working with, right? And then you need to do some weighing. Weigh some of your colostrum, weigh a quart or whatever, and get an idea what the different range of weights is and what the average weight of your colostrum should be. And then you need to know some timing information. Are you in operation where you got 24/7 monitoring? You can get the colostrum in almost all the cows within 2 or 3 hours. Or are you in operation where you don't have 24/7 monitoring? People have to sleep. So some of these calves might have to go 6, 10 hours before they get their first feeding. You need to know all that stuff. And once you know all that stuff, then you design your program. So what I have found works the best is like for Holsteins, typically they're feeding 3 quarts followed by 2 quarts the second feeding. Is there's been studies been done. You should not. We know unequivocally that you will induce colic or pain in these calves if they're fed around 10. The study just came out from Cornell University. The calves that got around approximately 10% of their body weight to the first feeding of colostrum, 30% of them colicked. They have video evidence of those calves laying there kicking at their abdomen when they're laying down. When they bumped it up to 12%, jumped to 45%. And then at 6 and 8%, the calves exhibit no signs of colic. So what I like to do is once I get the weight distribution of the cows, I mean, misspoke, the calves, and I know my approximate weight of my colostrum, right? I like to feed to the average calf. I like to feed about 7% of their body weight. And then that means the smallest calves will get around 9% of their body weight, and the larger calves will get 6% of their body weight. Okay, because because I think to be in the safe side, we should not be feeding more than 9.5% of their body weight. Okay, to just be in the safe side. So percentage of body weight. If a calf weighs 100 pounds and I feed 8% of its body weight with colostrum, that's 8 pounds of colostrum. You need to know the average weight of your colostrum. Typically, it's around 8.8 pounds per gallon or something like that, but it could be as low as 8.2 to as high as 9.4. You need to know this stuff, right? And then if you really get your herd veterinarian involved, you can start, if you know the brick score and you know the weight, you can start getting even more fine-tuned if you want. But you need to know the weight of your calves. You need to know the weight of your colostrum. And then once you know that, you can calculate the maximum volume you can feed, right? And then once you know that, then you build your program around it.
Mhm. And that's maximum volume at one feeding, right?
First
That's
feeding.
not, yeah, first feeding.
First
Yep.
feeding.
I just wanted to clarify that. Yep.
Don, talk about the importance of the temperature of that colostrum
Oh yeah.
at weighing.
Weigh your colostrum at body temperature of the cow or slightly warmer. And the reason for that is colostrum is predominantly water, okay? And water weighs differently at different temperatures. So let's say 1 liter of colostrum weighs 1,000 grams. That's only true at refrigerator temperature, which is 4 degrees Celsius. As you warm it up towards body temperature, and once you achieve body temperature and slightly warmer, 1 liter does not weigh 1,000 grams. It weighs 922.2 grams. Okay, so you want to get your weights on warm colostrum because if it's warmer than it should, what warmer it should be or a lot cooler it should be, it's going to affect your weight measurements. Because you think about it on a fixed volume. So let's say you at room temperature and you have a quart and you weigh it. If you heat that colostrum up to body temperature of the cow from room temperature, that colostrum will weigh less. So you want to do everything you do is based on the body temperature of the cow when you're doing your calculations for weight of the colostrum.
Another thing that we point out too, that it is okay to tube or use an esophageal tube feeder for that first feeding. It's always best to have the calf nurse or suckle because the suckling response will close that esophageal groove and divert the milk to the abomasum for appropriate passing and separating of components into the lower GI tract. And the jury's out, but for better calf husbandry, I like to say that if you have to use the esophageal tube feeder, use it the first time for colostrum feeding, and then if you need to use an esophageal tube feeder again, it should be used for animals that are sick or lack a suckle response. And those should be two different type of esophageal tube feeders. You should have one for healthy animals for colostrum and one that should be used for your sick animals. You don't ever want to cross mingle those two esophageal tube feeders because the last thing you want to do is give a sick calf's issues to a newborn calf with colostrum. Another thing that's really important with esophageal tube feeders too is if you have to feed that second feeding via a tube feeder, we recommend not, but if you have to, it should always be a lower volume than that first volume. Again, it's very hard to know when a calf is full if you're using esophageal tube feeder.
And I forgot to say this is that for Holsteins, once you know your weight and stuff, 3 quarts first feeding, 1.5, 2 quarts second feeding works really well. And you don't have to worry about overfeeding your calves too large a volume. But the quality side of things, you want a brick score of 25% or higher. And so that's where you got to work with somebody to help you. What do you do with the brick scores that are less than 25%? And the answer is you got to fortify it. with
Mhm.
with a high quality commercial replacement product that's been validated that they know it doesn't add too much to the osmolality of the colostrum.
Yeah, that was gonna kind of be my follow-up question was the fortification, right? Like, so I have a cow that doesn't produce high quality colostrum and I know it's low yielding. So I have to use some type of replacer. And oftentimes I get questions about the difference between a colostrum replacer and colostrum supplement. So can you clarify that for me?
Ryan can do that.
Yeah, so that's a great question. So a colostrum replacement is better because it's going to provide you the full replacement, and you want to make sure that you're getting the IgG per gram per liter to the amount of IgG that calf needs, where a supplement is going to have lower amount of IgG within that supplement. So supplement is going to be much less, where a replacement is going to basically be your replacement of the colostrum.
And again, probably working with your herd veterinarian to kind of come up with the best protocol for each herd because that's going to look a little different for every herd as far as what types they're using. And I would say even labor issues too, right? So am I going to use a colostrum replacer at midnight because I don't want to wait for it to thaw versus I have time to collect the colostrum and feed it to the calf right away. I mean, I think there's all kinds of different scenarios we could come up with as far as how we
Yeah, it's
use mix and mingle these types of products.
it's a great thing to keep in mind because employee acceptance and practicality is also something that needs to be considered when developing these colostrum programs. They're site specific, but you have to have buy-in by your employees too, because sometimes things are just above and beyond what is practical. So it's important to understand, all right, if we can't get good quality colostrum here, do we have a replacement that we could potentially use and one that is going to go into solution and understanding that working of utilizing colostrum replacement is really important to have your herd vet in that discussion and training.
Mhm.
I've had the best compliance when I get my basic data, like herd size, timing information, quality information of the colostrum by brick scores, whether it's single, whether it's pool colostrum or whatever, and knowing the weight and the average weight and the variance around the average weight of the calves, and just say to them, okay, you design your program. Just keep in mind you can't feed that 4 quarts for that first feeding for your smaller calves. Come up with what you think will work, and then and I'll look at it and I'll tell you if we can tweak it or it's fine as it is. And the reason I like doing that is because it's their program. They designed it and they're going to buy into it. It's not me
Mhm.
telling them what to do.
All right. So we get the colostrum in the calves and they go through uh, the milk fed phase, but they start to have issues. How do we verify or measure that our colostrum program is working?
That's another great question. A lot of it's kind of go. This is kind of mainstay, and it has been proven or looked at time and time again, is looking at IgG status in serum or your total protein. So it certainly can measure total protein at around 24 hours of age. And then there are those breakpoints or cutoffs of what is good quality transfer of passive immunity to calves. Um, so you can evaluate that via blood collection and serum evaluation.
And I just like to say something. I just finished we're in the midst of a study here, and I did all the serum total protein testing myself. I did all the bricks testing and a little over 100 and a little over 170 serum samples were collected from calves 24 to 48 hours 24 to 48 hours of age kind of thing. And it doesn't matter if you use a Brix refractometer or serum total proteins. Okay. The results are equivocal. It doesn't matter. Whatever works for you, use it. Okay. So don't get hung up. It has to be serum total protein because there's guidelines for Brix too. And when you look at the accuracy of them, there's no difference. It doesn't matter which one you use. So if you're more comfortable since you're using your bricks and your colostrum, then more people are using their bricks to measure their serum to measure their passive transfer immunity in their calves. But some people have some habits are hard to break. They want to still do the serum total proteins.
Yeah,
Whatever works. That's
which
the
is
point.
fine. I think it's important just to be on the same, you're communicating the same number, right? Because I was working with somebody that I was reading it as a bricks and they were reading it as a total protein. And we were trying to figure out where we were getting our numbers, and come to find out we were both looking at a different number. So I think that's
Mhm.
important.
Very
We've
important.
Everybody has done that.
Yeah.
Everybody's made. I know. I've done it myself. You're not alone.
All right. So I think you guys brought up a lot of good comments, a lot of good recommendations. We're going to kind of wrap it up here as we
Okay.
close out. And just as we conclude here, talking about key points we want our listeners to take away from this conversation. Can you each, provide some key takeaways from our conversation here today?
Ryan, you can go first.
Yeah, I would say that when you're building or at least maybe looking back into your colostrum management programs, what you should really focus on is having a high quality colostrum or being able to detect a high quality colostrum, like we talked about, provide appropriate mass of IgG in that first feeding, and then evaluate those lower volume feedings with appropriate timing, because that will help create a good transfer of passive immunity to those calves.
And so for this me talking, when you feed high quality, smaller volume colostrum, you're going to have more efficient absorption of all the goodies in the colostrum, higher serum hemoglobin levels. What doesn't matter if it's bricks or total protein, how you measure it, and you're going to have a healthier calf. But also, there's the long-term information starting to come out. Increased longevity in the herd, less shorter duration of scours, and the pneumonia stuff is really interesting. Uh, that based on passive transfer immunity, they got 4 classifications: excellent category, good category, fair, and poor. And they go through and you look at the instance of pneumonia in the 4 different strata of good, excellent, good, fair, and poor. The only strata that had a significant reduction in pneumonia was in the excellent. So now you have to, in excellent classification. So now you have to start thinking, and Scours was only in good and excellent. So now you have to start thinking, how do I get more of my calves in the good and excellent category? Because that the calves do a lot better. How do I do that? Well, I can tell you, you can't, you feeding 4 quarts followed by 2 quarts, you cannot do it. It's impossible. You have to feed a smaller volume of higher quality colostrum. And the calves, Apple Mesa will thank you, and you'll have a better, healthier calf.
Great. Those are good takeaways as we conclude here today. And I did have one side question that I needed to ask. What should our goal be for the number of IgGs that we put into that first feeding?
That is changing. That's a very good question. Okay. I can tell you that with the research that we've done and others have done, is it used to be for the typical Holstein calf. I'm talking about that 90 to 95 pound calf. Okay, let's say 95-pound calf. It used to be you want to get 200 grams of IgG in that calf for the first feeding, right? Well, but you can get now we have to get these serum IgGs up, so it's going to change. It's going to change from 200 to maybe 250 to even maybe 300 grams per liter for that first feeding. So total IgG they want to get in these calves, it used to be 200 followed by 100 for a total of 300. Now we know you got to get at least 400 in the average size calf, 400 grams of IgG, and it's totally linear. The more mass you feed in the right time frame, the higher your serum IgG. And it's amazing if you get a lot high mass of IgG. Like I have one that was fed 700 grams of hemoglobin in 2 feedings. Its serum IgG was 82 grams per liter. We tested it 3 times because we didn't believe it. And the calf was not dehydrated. And excellent for IgG is 25 grams per liter. And I'm sitting with one at 82. That's amazing how much they can absorb if it's high quality, small volume, and correct timing. And you get that second feeding into them.
And it's important to remember that our dairy cows today are producing very high quality colostrum. So being able to appropriately feed that colostrum and not waste it is another important part of this talk about how much as a number of IgG we can give to calves.
And that's why we ended up with all these problems with colostrum feeding and the allomecal health issues in these calves, because producers is explained to them the value of getting these serum IgGs up, and the simple way of thinking was, well, I'll just feed a larger volume, and it doesn't work that way. You have to think about maximizing the efficiency of absorption, the correct mass that is highly efficiently absorbed. That can only be achieved with smaller volumes, high quality. You want your efficiency absorption up in the above 40%. You don't want it down in the high 20s and the 30s.
Very cool information. I could talk to you too all day, but I guess I have to conclude our podcast here today. But great information. Our cows we have super cows and super calves anymore, right? They just are producing such high quality products, and we want to utilize them the best way we can for both the cow and the calf and make productive animals in the future. So colostrum is kind of where we start with all of this. So I appreciate you providing that input here today. I want to invite our listeners to check out our ISU Extension and Outreach Dairy Team resources, as well as I'll put into the show notes here the webinar that we did a few weeks ago about raising your dairy best heifer, where Dr. Sockett and Dr. Breyer went through the colostrum delivery strategies that we talked about today, in case anybody wants to kind of visually see some of the graphs and charts that we were referring to. You can definitely check that out. So thank you again, Dr. Sockett and Dr. Breyer, for translating research into practice. For more tools and resources, see our show notes. And thanks for listening to Dairy News and Views from ISU. And until next time, stay safe, stay informed, and keep making a difference in the dairy industry.
This institution is an equal opportunity provider. For the full non-discrimination statement or combination inquiries, go to www.extension.iastate.edu/diversity/ext.